Just ahead on this edition of Being Well, we'll be talking about aging and preventative medicine. Dr. Bernie Ranchero will discuss what health and diagnostic screenings adults should be getting each year and the possible effects of things like high blood pressure and glucose are left untreated. We've got a great half hour of information just ahead, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Welcome back to Being Well. I'm your host, Lori Casey, and today we're talking about aging and preventative medicine with Dr. Bernie Ranchero. Dr. Bernie is with Sarah Bush Lincoln Health System here in Charleston and with Charleston Family Practice. Thanks for coming back on the show.
Thank you.
So, in your practice, at what age do you start seeing people come in with what we'd call age-related medical issues?
You know, it can start at any age. Generally, we see age-related chronic conditions at over the age of 60, but we're starting to see them at age 50, age 40, even age 30.
And why is that?
Well, a lot of it has to do with our lifestyle. A lot of it has to do with chronic medical conditions. We're seeing kids these days develop type 2 diabetes. We didn't see that in the past, and now we're seeing that.
So what defines something as a chronic medical condition?
Generally a medical condition that lasts greater than 3 to 6 months.
Okay. So why do you think, you hear on the news all the time, you can do this to prevent this and this and this, but we generally as a population are kind of complacent about prevention. We're ready to do something when it's really bad, but why do you think we as a society get complacent about prevention?
I think part of it is because we think in the immediate, we think now. If I want something to eat, I go to a fast food restaurant. I don't think, well, it would be better if I take the time to choose better things, eat my fruits and vegetables, take time to cook it. Instead, we want something now. So preventative medicine is, we don't think, what's my health going to be like 5, 10, 20 years down the road?
So when you have a patient come in that's maybe presenting with some of these chronic conditions, what's sort of your, I don't want to say your spiel, but your spiel that you give to them about prevention?
Well, a lot of it is consequential thinking. For instance, one of the examples I use is, and I truly believe this, we take better care of our automobiles, our cars, our trucks, our tractors, than we do our own bodies, mm-hmm. and we need to have that same mentality. When do you get your oil changed? When it needs to be changed. My car these days will have a little message that comes on, preventative maintenance needed soon. Mm-hmm. We don't have a problem going to get a regular oil change, going to get our car serviced at 25,000, 50,000 miles, or when it needs it. And we need to do the same thing. How often are we told rotate our tires? How often are we told, have the correct air pressure in our tires, change the oils, change the radiator fluid? We do that on a schedule, and we need to be just as vigilant, even more vigilant and more aware with our own bodies.
Do you think people don't want to go to the doctor because they go, oh, I know he's going to tell me I need to lose weight and I need to quit smoke, all those things that we need to do. We just don't really want to hear it.
There's a lot of truth to that. Unfortunately, a lot of patients will come and say they don't want to come and see me because they know I'm going to find something, mm-hmm. or we're going to talk about preventative medicine, or we're going to talk about disease prevention. Now, when it comes to prevention, there are different levels of prevention. Mm-hmm. There's primary prevention, secondary prevention, and tertiary prevention. Basically, it comes down to, am I preventing a disease? Am I preventing a disease from getting worse? Or am I preventing the complications of a disease? So there's different types of prevention. And when it really comes to preventative medicine and really the treatment of chronic diseases, it begins with, let's prevent getting the disease.
Okay, so let's break things down into those 4 tiers. Let's start with the very first basic one. What should we be doing at that level?
Sometimes it's something simple, and it could be, are you staying active? Are you exercising? How's your weight? Do you smoke? If you smoke, stop smoking. If you drink a lot of alcohol, decrease the amount of alcohol you're drinking. If you're obese, lose that weight. Keep your mind active. Be social. Stimulate yourself, things like that. Those are simple things that we can do.
Mm-hmm. Simple and small, but add up after a while. It can make a difference.
It can make a huge difference. I mean, I use this example again, going back to the truck and cars. I tell patients, if I have a truck, a pickup truck, and I put 500 pounds in the back of that pickup truck. What's going to happen to the shocks, the struts, the CV joints, the tires? Well, in time, they're going to wear out, and the more mileage you put on it, it's going to give. And it's the same with our bodies. If we carry extra amounts of weight, if we don't change the oil, if our cholesterol is too high, our blood sugars are too high, if the oil, the fluids in our body are not good, what's going to happen? Our pipes are going to clog. What's going to happen to the engine? It's not going to run as smoothly. So we need to be more aware that the things we can do today will have a big impact of where we are later on in life.
Do you see patients that will say, well, you know, I've done this, I've had this bad habit, whatever it is, fill in the blank, for so many years, it's too late. There's nothing I can do about it.
You know what? And I think the point is for that is there's always time. There's always a future. There's always, if we can prevent something happening in the future, a heart attack, a stroke, then now's the time to do it. A lot of my patients, I know, wish they could go back 10, 20 years. They wish they can go back and maybe lose the weight, stop smoking, get healthy. And I often tell patients, well, now is your 20 years ago. Do it now, because I have patients in their 90s who wish they can go back to their 70s. I have patients in their 70s who wish they can go back into their 50s. I have patients in their 50s who wish to go back to their 30s, and so forth, that they can make better choices, because when they're older, it's very difficult to make those changes.
But it's never too late.
Correct.
So you had those 4 levels. You addressed the first level. Let's move to the second level of prevention.
Well, for instance, let's say you have your blood sugars are elevated. Maybe there's diabetes in your family, and you have something maybe we call metabolic syndrome. You have high triglycerides, your blood pressure is elevated, you have impaired fasting glucose. Maybe your waist circumference, for females it's over 35, for males over 40. So you're overweight. When you're in that metabolic syndrome, that pre-diabetic state, we can say, hey, you know what? Let's lose some weight. Let's start to exercise. Let's bring our blood pressure down, our waist circumference down, our triglycerides down. We can't affect our age. We can't change our genetics, but we can modify some of those other factors. So if you have that condition, let's prevent you from going on to getting a worse disease, from getting diabetes, or getting the complications of that disease.
So maybe it's progressed now to level 3. Things are, you actually have type 1 diabetes. You have high blood pressure. Still too late?
No. For instance, I have a patient. I'm very fortunate to work in the weight management clinic. I had a patient who's a healthcare provider. He was on 108 units of insulin. He lost 60 pounds in about 3 to 4 months. He's now down to 10 units of insulin. That's a big difference from 108 units to 10 units. Does he feel better? Yes. Is he going to have less complications? Yes. For instance, the number 1 cause of blindness in this country is diabetes. Number 1 cause of limb amputations, diabetes. Number 1 cause of dialysis, kidney failure, diabetes. So if we can prevent that, and also the cost financially, not only emotionally and physically, but financially to the patient and to our healthcare system, then we've done a good thing.
I'm amazed, I don't know if you're still amazed as a physician, how amazing our bodies are when we do these small things. Like the patient you just said, went from 100 units down to 10 by losing that weight. That's amazing that our bodies can recover like that.
It is, and I think a great thing it also shows is that we can change, we're adaptable. And once we have a chronic medical condition, we can improve with it. We can get better.
So one of the ways to, before you get to those diseases, is to do some general health screenings.
Yes.
So what do you recommend, Dr. Ranchero, for general health screenings for men and women? Let's start with just at age 50. What should we be getting when we go to the doctor?
Some of the simple things that really are recommended over the age of 50 are the things we recommend for anyone over the age of 6 months. For instance, a flu vaccine. So are you up to date on your vaccinations? Have you gotten your tetanus shot?
Yes.
Every 10 years. If you have a respiratory condition or a chronic medical condition, are you up to date on your pneumonia vaccine? Also, it's now recommended people over the age of 50 get their shingles vaccine. Herpes zoster can be a very painful condition. So number 1 is get your vaccinations. Are you up to date there? Are you up to date on getting your blood work checked, your cholesterol, your liver, your kidney, your complete blood count? Screenings that would be simple, your thyroid checked. Those are just lab work you can get done. But also It could be you're making sure over the age of 50 you've gotten your colonoscopy, which is very important, screening for colon cancer. If you have a family history, it needs to be even done before the age of 50. And then for women, making sure you're up to date on your Pap smears, your mammograms.
And that, we should say, starts well before 50.
Correct, well before 50. Well, making sure you're up to date on those. And for men, the option of getting your PSA, your prostate-specific antigen checked.
So what about some of the more, you touched on colonoscopy, that's probably be more of a diagnostic screening. Other diagnostic screenings that should be done at that age 50 mark?
Well, again, I think one of the most important things is, have you had your cholesterol checked, your triglycerides checked? And also the other thing is making sure, one of the reasons you want to have an annual exam is, what are your vital signs? Do you have high blood pressure? Hypertension is a big thing. How is your breathing? Have you had your eyes examined? I mean, once a year at least, going to the dentist twice a year. So some of those simple things that we always forget. But again, if we had an owner's manual for the body, it would say those things just like you would say in your automobile manual.
Or have your car dealer call you up and say, by the way, have you had your blood pressure checked?
Correct. Just like the 25,000 mile check, the 50,000 mile check, these are the things that are recommended.
But you shouldn't wait until you're 50 to start going to the
Correct.
doctor.
And the other thing is, don't necessarily rely on your physician to bring everything up. Be proactive. You can go to the government sites to get it done. United States Task Force on Preventative Medicine, they have the list of things that you should get done.
So I'll ask you this question. You probably have, you just listed off a list of tests, which are expensive, especially if you don't have insurance. How do you address people that say, well, I can't afford that, or that's going to be really, really expensive to have all this stuff tested for?
And I address that several ways. Number one, I've asked patients the flat out question, how much is your health worth to you? And really, when it comes down to it, if you don't have your health, what do you have?
Not much.
Not much, exactly. And the other thing I ask patients is, how much do you spend on cigarettes? How much do you spend to get your hair done? How much do you spend for your car insurance? How much do you spend on your car payment? How much do you spend on things that you spend on it for daily living? And the question really comes down to is, don't you see yourself worth more than that? And that's part of your health. And if it means, I don't know, how much is another birthday worth to you? How much another anniversary? How much is another Christmas, another Easter, another Memorial Day, another July 4th, another day of health? How much is it worth to you? And really, health is invaluable. And I would say, ask a sick person how much they would pay to get their health back.
Very well said. And when you think about it, it may seem expensive now, but a heart transplant later down the road is a lot more expensive than just getting your cholesterol checked and under control.
And I think a lot of it is letting patients know, especially as we get older, what is important in your life. What are the things you do that you enjoy doing? It might be a grandmother saying, I want to go for a walk with my grandchild to the zoo and not feel winded. It might be the grandfather saying, I want to take my grandson and my son out fishing and not worry that I can't breathe. Or it could be someone else, a mom or dad saying, I just want to play with my kids and not feel winded, or not worry that I'm not going to be there for their graduation or other important life event.
So do you think we are getting better about preventative medicine as patients? Do you think we're kind of turning the corner, or we still have a ways to go?
I think the answer is yes to both of those. I think we are getting better, but at the same time, we have a long way to go. And I think part of that is, why do we still have 67% of our population that are overweight and obese? One of the hats that I wear at Sarah Bush Lincoln is Medical Director of Employee Health and Wellness, and as well as Occupational Medicine and the Center for Healthy Living. And we actually did a study at one of the local high schools. And we showed from freshman year to senior year, they went from about a 30% overweight, obese percentage to, by senior year, they were about the national average of 60 to 67% of overweight and obese. And that was at a local high school. And it just shows you that we need to be, even though we're doing a good job of getting the message out there, we still have a long ways to go, because of the obesity epidemic because people still smoke, because we're not doing things that we know that we can prevent.
So do you think obesity is one of the major factors that starts all these other things into motion?
I think it can be a root cause, definitely. I mean, if we smoke too much, if we smoke, period, if we use tobacco, we need to stop it. And we need to somehow try to substitute something if we're smoking. But the obesity epidemic, it can lead to the diabetes, hypertension, strokes, osteoarthritis, a lot of problems, a lot of chronic medical conditions that we can prevent or lessen the complications.
Okay. I want to switch gears a little bit and talk about some of just the signs and related effects of some of these chronic things. And we'll start with high blood pressure. Unfortunately, there's not a lot of signs that you have high blood pressure, maybe a headache, maybe some pounding in the ears, but what other signs are there? And then what are the long-term effects of high blood pressure?
Some of the signs, like you said, because we get used to that high blood pressure, we don't realize that we have hypertension. Blood pressure, if you're under the age of 60, should be 120/80. If we're over the age of 60 and we don't have other risk factors, then it could be up to 150/90. Now, like you said, could it be a headache? Could it be blurred vision? Could it be palpitations, or you feel your heart rate? Sure, some of those things could happen. Hopefully, you won't have some of the heart attacks, chest pain, strokes, signs and symptoms of a transient ischemic attack because our blood pressure is getting too high, kidney problems. So those are all things and complications that can happen from high blood pressure, and hopefully you catch it earlier. And this is why we always recommend go see your doctor at least once a year. Get your blood pressure checked. And oftentimes, unfortunately, sometimes using your own machine or getting it done at a store sometimes isn't as accurate, and that's why we always recommend, if you do have a machine, bring it into your physician's office, have the nurse, have the doctor check it to make sure it's accurate.
And I think, as in the case of my family, it runs in my family, so I've been aware of that for quite a while. So I think knowing your family history too is important. Let's talk about high lipids or high cholesterol.
Right, and
is there any signs of that?
You know, that's interesting.
Outward signs?
Some people can have cholesterol. You'll notice some skin tags or cholesterol deposits on the skin, around the eyes. But by then, you've had cholesterol a long time. And oftentimes, by the time you notice that your cholesterol is too high, especially if you have a family history of it, get it checked. The best way is to get it checked. Get it checked by blood work.
Okay.
And you need to be fasting for that, by the way.
And high cholesterol leads to heart disease.
High cholesterol can harden the arteries. High cholesterol can clog your arteries. High cholesterol can lead to heart attacks, can lead to strokes. I always tell my patients, it's a matter of, think about if you had a pizza. Remember, the area of a circle is pi r squared. So if you look at the radius of a circle, and say you have a pizza that's 10 inches the radius is 10 inches. So that's 10 times 10 is 100. If you decrease it just by 20% that radius, what is 8 times 8? 64. You've gone down even more in that area of that circle. The same thing happens with your blood vessels and cholesterol deposits.
Okay, let's move on to high glucose or high blood sugar. That's a scary one. It
is a scary one, and we're seeing more and more of it. And what happens when we have that impaired fasting glucose, when we have sugars that are elevated, and that especially sugars after we eat meals that are elevated, that can lead to metabolic syndrome, prediabetes, and eventually diabetes. And again, we talked about that earlier. The dangers of diabetes, it's as having diabetes, the risk factors for cardiac is as if you've already had a heart attack.
And why is that? Why is diabetes so hard on your vessels?
Microvascular changes.
Okay.
Again, let's go back to the car analogy. If the fluid, your oil in your car is really thick, then it doesn't flow well, and it doesn't lubricate the parts very well. So let's say you have your blood and you have high sugar content. When you have a fluid that is full of sugar, that's like corn syrup, what's the viscosity?
Yeah,
it's very thick.
Yes.
It's very thick, and that thickness causes a lot of damage to your vessels, to your heart, to your eyes, to your kidneys, vessels in your extremities and things like that.
So it's a bad one. You don't want that.
Well, and you definitely don't want that. And sometimes I think the worst thing is when you get not only you get that triad, you get high blood sugars, high hypertension, high blood pressure, and then high cholesterol, high lipids. And sometimes those go hand in hand. And unfortunately, that trifecta can lead to a lot of problems.
Okay. Well, let's talk a little bit here in these last few minutes. Let's talk about some general preventative measures that you think all mature adults and maybe not quite as mature adults should follow, because we should be starting this a lot earlier in life. What would you say?
I think some of the main ones are simple. I always tell patients, if we can do things by lifestyle modifications, if we could do things by exercise, if we could do things by supplements, if we can do things that are non-pharmacological, we should go that way. If we need to go the pharmacological route, we can do it. But some of the lifestyle things that we can do, if we smoke, stop smoking. If we use some sort of tobacco product, stop using it. Number two, if we drink alcohol, we need to moderate that. Now, drinking 1 or 2 glasses a day is actually good for your blood pressure. But obviously, if you have a family history of alcoholism or liver problems, then you need to watch it. And I think really a big one is if you're obese, lose weight. Really get down to where your BMI is less than 30. Hopefully get around to 25 to 27. If you don't exercise, exercise. Even a simple 10-minute walk a day. The goal really is about 150 minutes a week. And then also go to your doctor, get your labs checked, make sure, do all the preventative screenings. Do what you need to do to stay healthy, just like you would if you want your car to last to 200,000 miles or over 100,000 miles, you need to take care of it. You need to make sure things are in alignment. You need to make sure that you're up to date. And I'd say that with your body. Make sure you're doing simple things. It could be eating 5 servings of fruits and vegetables a day, something simple like that.
Or just doing that, replacing, instead of this, have this today.
Correct.
Put that in your, I did this, I'm good today pile.
Exactly. Sometimes I challenge my patients. The number one leading factor to obesity in our country today, and this has been identified in numerous studies, and especially when it comes to developing diabetes, are sugar-sweetened beverages. I just challenge my patients, stop drinking sugar-sweetened beverages or replace it. And that's just a simple thing you can do. Instead of drinking that big 32-ounce big gulp of pop, replace it with water or something that doesn't have calories or sugars in it. Just do something, even if it's just one positive thing towards your health.
I think there was a ad or something, small steps, and take small steps like, replacing the pop. I've tried that. I've done it. We're taking out the diet soda. It's hard, but you feel like a little victory when you can do that.
It is a little victory. It is. And even I tell my patients who smoke, can you smoke 1 less cigarette a week? Not a day, a week. Just smoke 1 less a week. And eventually they'll get down to 0.
Yeah.
But just smoke 1 less a week.
You didn't start smoking a pack a day.
Right.
You didn't gain 10 pounds in a day. It's not going to come off in a day, but you can make those small changes. And that will hopefully lead to long-term health effects, good long-term health effects.
Yes.
Dr. Ranchero, thank you so much for stopping by, being well today, and we love your car analogies. Very helpful in helping us kind of wrap our head around prevention.
Thank you, Lori.
Thanks.
One out of 4. That's how many people will die of a heart-related problem. Doctors at Mayo Clinic are trying to improve those statistics. They're using MRIs to look inside the heart to find disease and tailor treatment to keep people healthier longer.
You can breathe normal.
Magnetic resonance imaging, or MRI, allows doctors to look inside the heart as it beats.
You can see here, this is the left ventricle, which is the main pumping chamber that pushes blood out of the body.
Dr. Brian Shapiro uses MRI to look for abnormalities in the heart.
What the MRI does is it looks at the tissue characteristics of the heart. So swelling of the heart is a very common thing in heart attacks and infections and things like that.
The moving or still images show exactly where damage happens.
You would see it as a very bright spot in the heart.
In addition to damage from heart attack or infection, MRI can also show Dr. Shapiro how well the heart pumps, where irregular heartbeats originate, the location of blood clots, artery blockages, scar tissue, or even tumors. Because MRI allows doctors to see more detail of the heart, they can make more accurate diagnoses and therefore tailored treatment for patients.
Is you can actually show where the heart attack is and the extent of the heart attack.
Images that tell Dr. Shapiro if a patient will recover, if there's permanent damage, and what treatments might be best. Information from inside the heart that can help Dr. Shapiro and his colleagues better help their patients. For Medical Edge, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes.